The Australian Medical Association has cast doubt on Labor's claim that all you need is a Medicare card to see a GP. It says while that might be true for the urgent care clinics, it can't be said for the regular GP because a gap fee will still be charged. Joining us live is the AMA President, Dr. Danielle McMullen. Doctor, thanks for your time this morning. So you've called this a fantasy. Why?
What we've said is that while the quantum of funding is excellent and it shows the degree of investment needed in general practice, what we're frustrated by is the lack of reform. We know Medicare was invented 40 years ago when people had simple problems, but now Australians want longer with their GP, and these bulk billing incentives don't help people get that extra time with their GP or more time with our practice nurses or other allied health staff in the clinic. And what we really need to see in Medicare is reform of that structure and a modernised Medicare that's fit for purpose now.
So what does reform mean in your view?
So in our view, we need to modernise the structure of Medicare, make sure that all Australians get a decent rebate regardless of the length of their consultation. At the moment, you get the same Medicare rebate whether you sit in this clinic for 10 minutes or 19 minutes. So twice as much time with your doctor only still gives you the same rebate. And for us to keep our doors open, that does mean we're charging larger out-of-pocket costs, and the new investments don't always meet the cost of providing that comprehensive care, so it's time for broader reforms to happen.
So the price tag here, it's already high. It sounds like it needs to go much higher to satisfy you.
Look, in fact, our costings of the reforms that we had put forward were less than what the government has committed and is in the budget measures. So it's not all about money. It's also about the structure underlying these things, and making sure that all Australians have access to reasonable Medicare rebates. And so then we can really target our bulk billing incentives at those Australians who do need it most, because we know cost of living is a real challenge and we are doing our very best to reduce or eliminate out-of-pocket costs where we can, but it's got to be in a system that makes sense.
So on average, what will the out-of-pocket cost for patients and doctors be as things stand under this policy, which is also backed by the Coalition?
Yeah, this is coming in November, and what we're encouraging Australians to do is to talk to their GP about what their practice will be doing after November. We know clinics around the country are looking at how this may or may not affect them. In some areas, it may mean that more bulk billing is available, but in others, we won't see any change. In many parts of Australia, we're seeing the average out-of-pocket cost is just above $40, and so the $20 extra incentive doesn't meet the costs of providing that comprehensive care.
So there is still truth to the claim that, yes, you need a Medicare card, but you also need a credit card, and that'll continue.
It does depend. It's important that Australians get access to that high-quality, comprehensive care, and for some people that will still mean paying an out-of-pocket cost.